Hello viewers, you're welcome back to the Guided Midwife channel. Please, if this is the first time you're coming across my video, this is the Guided Midwife channel and we talk about everything preconception, pregnancy, labor and postpartum. So please, if you are really interested in my videos, please kindly subscribe to my channel for more educative videos. If you also have any question, you can also leave it at the comment section and I will reply you with the answer. So please, on today's episode on the Guided Midwife channel, I'm going to talk about the physiological changes that occurs during pregnancy. So when we say physiological change, it's an adaptive response in a person towards something in the environment. So at some point in time, everyone on this earth undergoes some physiological changes. So let me give a scenario. If I find myself in an environment where the weather is very cold, my body will undergo some physiological changes to adapt to that cold weather. Or if I find myself in an environment where the weather is very hot, my body will have to undergo some physiological changes to adapt to that hot weather. So here is the case: a woman is pregnant. The woman's body is going to undergo some physiological changes to allow the baby in the uterus to develop in her. So the woman or a pregnant woman also undergoes some physiological changes. So because there is a foreign body in the uterus developing, the body of the woman must undergo some physiological changes. So some of these changes occurs right after fertilization. Others too occur during the course of pregnancy. So these changes affect all the systems. When I say systems, I'm talking about the reproductive system, the cardiovascular system, the integumentary system, the urinary system. We're going to talk about the changes that affect every system. So I'm going to start with the reproductive system. There are some parts of the body and organs that forms the reproductive system. You have the cervix, the vagina, the uterus, not forgetting the fallopian tubes and the ovaries. So during pregnancy, there are some changes that affect all these organs: the vagina, the cervix, the fallopian tubes, and the ovaries, and the cervix. So the uterus is like a pear shape, that avocado pear that we eat. When you are not pregnant, the shape of your uterus or your womb is like a pear shape. So during pregnancy, the uterus increases in size to allow the fetus or the baby to develop inside. So during pregnancy, there is increased blood supply to the uterus. The uterus becomes vascularized. There is enough blood supply to the place because that's the place where the baby or the fetus has been embedded. The cervix also becomes vascularized. So the vagina also becomes vascularized. There is increased blood supply to the vagina. It also becomes elastic. Elastic as in it becomes stretchy, for it to accumulate the baby during labor, like for it to dilate, for the baby to also pass through. As a lady, even if you're not pregnant, there's this kind of normal whitish discharge that comes out from your vagina. If this discharge is odorless, it doesn't have any odor in it. So during pregnancy, this discharge it increases. So some women during pregnancy, they come to the ANC and they will be like complaining that they've been having increased vaginal discharge. If it's not offensive, it's okay. That whitish discharge is due to the shedding of the lining of the vagina and the cervix. It's plenty. So like the women really complain. So as a midwife, if a woman complains that she is having an increased vaginal discharge, which is not offensive, we educate the woman to be changing panties regularly. Others too tend to use panty liners. Then they will just change the panty liner and put another one there. So, and if your panties becomes very wet, it serves or it creates a medium for the growth of microorganisms. So if you are not cleaning that place well, you can get infections due to the increased flow of that discharge. So you have to keep the place dry. So anytime you see that the discharges are plenty, you just change your panties, or you can use panty liners as well. So but if the discharges becomes offensive, it means you've had an infection. It has become pathological. So you have to see your midwife or a doctor for you to be treated. Let's move on to the ovaries. So during pregnancy, ovulation ceases. Yeah. But I've heard people saying that I was pregnant and I was menstruating as well. Yeah, I have a friend who was pregnant without her knowing she was. So she was menstruating. So by the time she realized, she was like 3 to 4 months pregnant. Yeah. It's due to the hormones, the estrogen and progesterone, And others too, it's not like they are menstruating. We have something called the implantation bleed. That's when the fetus is embedding or implanting in the uterus. There's this kind of like small bleeding that comes out, and they just see it as menstruation. But if you are pregnant and you are menstruating, like most of the time it occurs within the first 3 months. Yeah. So after that month, if you still see blood, please come to the hospital or come to the hospital for the midwife or a doctor to attend to you. Like when you are pregnant, you shouldn't see any blood. We have something called the antepartum hemorrhage. It might be an abortion, you wouldn't know. You just be sitting there and you be thinking it's menstruation. I've heard that people menstruate whilst they are pregnant. We have something called the placenta previa. There are so many causes of those bleeding during pregnancy. So if you see blood coming out from your vagina during pregnancy, please don't stay at home. It's a very serious issue. I'm not trying to scare you, but don't stay at home. Come to the hospital for a midwife to attend to you. Let's move on to the changes that occurs in the breast. When you are ovulating or when you are about to have your menses, you have this kind of heaviness in your breast, that tingling sensation. That's what happens during pregnancy. You tend to have this heaviness in your breast, and that kind of tingling sensation is due to the hormones, the estrogen and progesterone. They are playing their roles here. So, the breast, we have this darkened portion where the nipple is called the areola. Although it's dark, but during pregnancy it becomes more dark. It's called the secondary areola. After 3 months, colostrum, it can be expressed from your breast. That's the yellowish breast milk or the first breast milk. It's very, very nutritious. It contains like high levels of like protein, fats, and everything. So it's very good for the baby. That's why right after delivery, we allow mother to put baby to breast for the baby to have access to that colostrum.